This is what varicose veins look like. But why?
These thin, wispy valves within your veins. So as the muscle pumps, they float like this and blood returns towards your heart. As the blood tries to run backwards down into your leg, these valves are supposed to close. In many patients, they don't close adequately, so you have reflux through that set of valves. That increases the pressure to the next set of valves and the next and the next.
Pregnancy can bring them on, as well as another form we commonly call hemorrhoids. But after giving birth, the swelling usually goes down. Obesity, standing or sitting for long periods of time, and age can all be culprits. But let's put to rest some rumored causes of varicose veins.
If you cross your legs and cut off the blood flow to your deep system, you can get clots in the deep system. You have to cross them pretty hard and have an awful lot of weight on it to really cause much problem.
You don't necessarily have to wear support hose all of the time, but the real thing can help.
The man who invented or discovered those was an engineer who had venous insufficiency. And so he realized that he felt better standing in a swimming pool. And he thought about that, and while everybody else is looking at the pretty girls, he figured out that the gradient of pressure within the water was helping his venous return. And so from that came the Jobst. His name is Conrad Jobst, and the Jobst stocking, which has made, if not him, his heirs probably billionaires by now.
About half of American women and a little less than half of men suffer with the ache and unsightly bulge of varicose veins, or worse. They
can rupture when you have venous hypertension. It's dramatic when it happens because you're usually standing up. For some reason, it often happens in the shower. You get this blood, while you're standing up, there's a lot of pressure in the vein and just spurting blood across the shower, and it makes for a real scene.
Blood clotting can also be a problem, and the lack of blood flow can cause ulcers on the ankles. The latest in surgical procedures is making it easier to show off those legs, though.
For the last 5 or 6 years, the laser's been available. Make a small entry site down in the lower calf, just with a needle percutaneously, put a wire up through the vein. Then we put a laser fiber up to replace that wire and infiltrate local anesthesia around it and burn the vein shut.
Doctors use an ultrasound to check the condition of the vein and guide the laser. The procedure usually takes less than half an hour, but if the veins are too large, doctors may have to follow up with a phlebectomy, which basically involves removing a section of the vein through a very small incision.
I tell people, if you owned a small business and people are stealing money from you, you're back the next day or two. If you have a job where you've got some time saved up and need a little time off, well, then you're usually off work about a week.